Welcome back to Med School Radio. We're going to be looking at some flashcards from a popular MCQ website. We're just going to be going through these randomly, so try and follow along. First one is regarding bipolar disorder. The anticonvulsant valproate has mood stabilizing properties and is an effective maintenance treatment for bipolar disorder. Other maintenance options for bipolar disorder include lithium, lamotrigine, and quetiapine. So that was about bipolar disorder and valproate. Okay, the next subject is ACE inhibitors. In the kidney, angiotensin II preferentially constricts the efferent arteriole, thereby maintaining the glomerular filtration rate, or GFR, within normal range. ACE inhibitors promote efferent arteriolar dilation, causing GFR reduction. Next, regarding drug metabolism and clearance, heart failure leads to reduced liver and kidney perfusion, resulting in reduced drug clearance. Metformin is excreted unchanged by the kidney. Therefore, patients with significant renal insufficiency due to heart failure or other causes, for example, chronic kidney disease, are at increased risk of toxicity, for example, lactic acidosis. Next one, regarding opioids. Opioid intoxication presents with meiosis, depressed mental status, decreased respiratory rate, decreased bowel sounds, and hypotension. Of these, decreased respiratory rate is the best predictor of intoxication and is also a frequent cause of mortality. Okay, the next one is regarding respiratory alkalosis. The normal physiology of pregnancy involves chronic hyperventilation caused by elevated progesterone levels, stimulating an increase in central respiratory drive. This creates an expected respiratory alkalosis with metabolic compensation, which is the increased renal bicarbonate excretion that helps facilitate the transport of acetic wastes from and the transport of oxygen to the developing fetus. Okay, next one regarding anticoagulants. Heparin-induced thrombocytopenia, or HIT, is treated with direct thrombin inhibitors, DTI, such as argatroban. Both high molecular weight heparin and LMWH should be avoided in these patients. Next, regarding benign prostatic hyperplasia. 5-alpha reductase inhibitors, for example, finasteride, ductasteride, block the conversion of testosterone to dihydrotestosterone in the prostate. These drugs reduce prostate volume in patients with benign prostatic hyperplasia and relieve the fixed component of bladder outlet obstruction. I'm just going to close the window. The train and cars are just too loud. Okay, so that was regarding BPH. So I'll just repeat the top part. 5-alpha reductase inhibitors, for example, finasteride, ductasteride, block the conversion of testosterone to dihydrotestosterone in the prostate. Next one, this is regarding lung transplantation. Chronic rejection is a major problem in lung transplant recipients. It affects small airways, causing bronchiolitis obliterans. It is characterized by lymphocytic inflammation, fibrosis, and ultimately destruction of the bronchioles. Okay, next one. This is regarding brain herniation. Transtentorial, i.e. uncal herniation, is a complication of an ipsilateral mass lesion, such as a hemorrhage or brain tumor. The first sign of uncal herniation is a fixed and dilated pupil on the side of the lesion, ipsilateral paralysis with oculomotor muscles, contralateral or ipsilateral hemiparesis, and contralateral homonymous hemianopsia with macula sparing may also occur. Next, regarding hip fracture. The greater trochanter of the femur serves as the site of insertion for the gluteus medius muscle, which is responsible for hip abduction and stabilization of the pelvis during ambulation. Fractures of the greater trochanter, for example, fragility fracture from a fall, can disrupt the integrity of the gluteus medius tendon and result in lateral hip pain with gait instability and weakness of hip abduction. So remember gluteus medius muscle. Next, regarding risk, rate, prevalence, and incidence. Prevalence equals the incidence rate multiplied by the average disease duration. Changing disease prevalence in a steady state population with a constant incident rate means that there is an additional factor affecting the duration of the condition. A factor that prolongs disease duration, for example, improved quality of care, will increase disease prevalence as affected patients survive longer. Okay, next let's talk about reactive arthritis. Reactive arthritis is a spondyloarthropathy associated with HLA-B27 that can occur following infection with chlamydia, campylobacter, salmonella, shigella, or yersinia. It presents with sterile arthritis due to deposition of immune complexes. So that is reactive arthritis. Okay, now let's talk about epiglottitis. Epiglottitis causes rapidly progressive respiratory distress and a swollen epiglottis. Look for the thumbprint sign on a lateral neck x-ray. The most common pathogen is Haemophilus influenzae, i.e. type B, non-typable strains. A gram-negative coccobacillus that often causes concomitant bacteremia. So let's read that again. Epiglottitis causes rapidly progressive respiratory distress and a swollen epiglottitis, thumbprint sign, on lateral neck x-ray. The most common pathogen is Haemophilus influenzae, type B, non-typable strains, a gram-negative coccobacillus that often causes concomitant bacteremia.